Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined with Chairman Mark Kern and Sam Bierman from the Health Department. And Sam, today's our question and answer day, but first you get to bring the news of the numbers.
So as of today, 69,328 St. Clair County residents have been tested, which is an increase of 393 from yesterday. We are at 6,259 positive test results, which is an increase of 28 from yesterday. And that does include both males and females from under the age of 10 up to their 60s. We are at 7.1 for our daily county positivity rate, and are at 63,069 negative test results, and are still holding at 176 deaths, so no new additional deaths to report today. For those who have completed their IDPH required 10-day isolation period, we are at 5,441. For state totals, 4,418,372 have been tested, with 249,580 positive test results, which is an increase of 1,403 from yesterday. And for deaths, the state is reporting 8,171, which is an increase of 5 from yesterday. For hospitalization numbers, and the first set of numbers I'm going to announce are for St. Clair County hospitals. Currently, we have 62 patients that are admitted due to COVID-related reasons, and one of those individuals is on a ventilator. And the second set is our regional hospitalization numbers. And for our region, we are at 106 patients that are admitted due to COVID-related reasons, and 11 of those are on ventilators. We have no new additions to our congregate living facility in outbreak status list today, so we are not going to announce anyone. We always like those days when we have no new additions to those to that list. And just as a reminder, we have testing coming up on Tuesday at the Hollywood Heights Fire Department, and that is from 10 a.m. to 12 p.m., and then again from 1 p.m. to 3 p.m. Tomorrow, the Jackie Joyner Kersey testing site will be closed, but will open again on Tuesday. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So today on the zip code reports, we're only going to read the zip codes where we have increases, or we have one that has a decrease. Because of fewer numbers today, we can shorten this segment of the live feed. So we'll start with 62208. We go up 5 today to 386. 62220 goes up 1 to 485. 62221 goes up 5 to 589. 62223 goes up 3 to 360. 62226 goes up 2 to 653. 62232 goes up 1 to 172. 62243 goes up 1 to 88. 62254 goes up 2 to 220. 62257 goes up 1 to 34. 62258 goes down 1 to 158. 62260 goes up 2 to 115. 62269 goes up 3 to 495. 62282 goes up 1 to 9. And 62285 goes up 1 to 73. Today, according to the state, our regional positivity is 9.6%. And of course, according to our numbers, the daily St. Clair County positivity is 7.1% today. Herb?
Numbers. So today is our question and answer session, and we're going to get into that right away. We have one just came in here. Person says, do you all get any days off? Hope you're able to get some rest and take care of the families. Well, our commitment is to bring the latest information daily, and hopefully that day will get here soon to where we can get some time off. And some of you are probably tired of hearing this, but Team St. Clair likes to hear the daily updates. And as we said, these numbers are the most accurate that we have. Yes, we scratch our head on some of them from the state, but our local numbers is what we're giving you straight from our health department. So Brian, we're going to get into the question and answers, and I know you got several of them that came in today.
Yes, sir. We'll get started with some health department questions. Sam, the first one that came in says, why don't hospitals test their employees since many employees could be asymptomatic?
So that would be a decision that each hospital would make on their own. based on policies and procedures that they have in place, when to test their employees, if they test them at all, and what the circumstances would be. So that would be up to each of the individual hospitals.
And they're all receiving guidance from IDPH or
Correct.
CDC that tells them what particular situations have to be done.
Exactly.
And if that was a question from a hospital employee, they can go to their administration and to their supervisors and find out that question. We wouldn't have that answer.
Correct.
The next person says, my doctor's office performed the test on me and my husband. When the test came back, we asked if they sent the results to the state or local health department, and they told us they did not since our test was negative. If that is true, how does our test get counted in the percentage that the state claims they use?
So all positive and negative test results that are done for St. Clair County residents should be sent to the health department. For the individual that asked that question, if you're watching the briefing today and you would like to call the health department, we're happy to speak with you, get your doctor's office and their information, and follow up with them to make sure that they're aware that all results, positive and negative, should be reported to the health department.
Okay, thank you. The next one says, if there is a student who tests positive and has been in a classroom, are the other students and teachers supposed to be notified that there was a positive student in their classroom?
So just like the guidance that IDPH normally puts out, what we use for our close contact definition, which is closer than 6 feet for more than 15 minutes, that is what IDPH is using for the school guidance as well. And that those individuals would be contacted and informed. And the schools, we have a great relationship with our schools in St. Clair County, and they can call us for any questions they have on guidance. And those individuals would be told that they were exposed to someone that was positive. However, we would not be giving out the name because that would be a HIPAA violation, but they would be informed that they were exposed to a positive.
Okay, the next one says, why do you keep the cumulative numbers of those in long-term health care? If they aren't in outbreak status, why keep reporting that they had some months before?
So the reason we do a cumulative number is we feel it's important to look at where we've been and where we are now. And by doing that, we can look at those numbers as a whole for each facility.
And daily, you're only now announcing changes at those
Correct.
facilities.
So every day, if there is a change, whether that be a change in cases or the number of deaths at each facility, we're only announcing those that do have any changes.
But we also want to say that, there was a time when if a congregate facility got a positive, that would grow. And now they seem to really have a handle on being able to isolate and control COVID-19 in those particular facilities. So we haven't really seen a terrible growth in those numbers, and that's a real credit to all the congregate living
Absolutely. Our
facilities.
cases have been minimal in our long-term care facilities, and that's a testament to how much work their administration and their staff have put in to keep their residents as safe as possible.
Well, it's a reminder for us where we started and where we are now. So I think it's really keeps us fresh too to know that we don't want to go back that way.
No.
The next person says, I was told there is not a test to specifically test for the COVID-19 strand of coronavirus. I find this hard to believe, and now I'm confused.
So the tests that are being used in our area are specific to the COVID-19 strain. I'm not sure, who you were speaking to, but the test that we are using is specific to the strain that we are testing for.
Okay. Now the next one says, can someone explain why it's important to be tested if we're not sick?
So as we've seen, people can test positive even if they are completely asymptomatic with no symptoms at all. And it's important to get them tested because if they happen to have no symptoms but do turn up positive, we want to isolate that individual to help stop the spread of COVID.
And something we've talked about a lot with the method of testing that's being utilized here in Illinois and that positivity rate. In order to do that, it's important to capture the largest portion of the population possible.
Correct.
So you can find out if there are asymptomatics, who they've been exposed to stop that spread. So by utilizing the positivity rate, it would be important for us here to try and capture the largest portion of that population.
Absolutely. And by testing and finding out where people were, we're learning more about, COVID-19, how it's evolved, and, that helps keep us a step ahead in not only treatment, but helping slow the spread.
Sam, we'll do one more here real quick. It says, is local contact tracing being conducted? Where are most of the COVID cases originating from?
So yes, absolutely, extensive contact tracing is being done by us at the health department, and we are finding that most of the cases are coming from private gatherings and the workplace. And we find that out when we talk to the individuals to find out where they've been up to 48 hours prior to either the onset of symptoms or a COVID positive test.
Well, Sam, and I think it's worth mentioning too that one of the issues is people have to be honest if they will, and some people won't be. So, they may not want to tell you where they were at. So it's kind of a check and balance that the contact tracers have to try to get that information and get the most truthful information out there.
Exactly.
So it's kind of hard to pinpoint. We're basing it on what they're telling you. So.
And let me assure everyone that when we do our contact tracing, if you are, if you've been at a party and you are that positive individual, your name will never be released to anyone that is being contacted by the health department to let them know they were exposed. We would simply say you were at this location and you were exposed to someone that was positive. Your name will never be revealed to anyone that we call.
Thank you.
And that's also why getting good contact tracers is important, and it's not as easy as it sounds. They
It is
have
not.
to almost have
Investigate.
law enforcement background to be able to question, ask the right questions, and elicit the right answers. There's a good trick to it.
And it's about building, a relationship with these individuals. Depending on the situation, it's possible we could be talking to them every day for 10 days or 14 days, and that's a long time to talk to someone every day. And we want them to feel comfortable with us as a health department and comfortable with their individual contact tracer.
Right.
Okay. Thank you.
Chairman Kern, a couple that have come in here for you. First one goes into your zip code report you do every day. The person says, Chairman Kern, when you announce the zip codes, is there any way that you can show us what area of the county that zip code covers?
So every day we post the zip code numbers on our EMA page. Along with those numbers, we post a link to the Illinois Department of Public Health website. On that website, they show all of the zip codes in the county and with the associated map that I think you're looking for. So click on that link. If that isn't what you're looking for, let us know. We'll try to get you the best information we can.
Okay. The next person writes, there is much talk about the numbers being inaccurate. Why can't someone explain what's right and what's wrong? There are many local articles on Facebook, but no one of authority seems concerned.
So I'm not aware of any counties, frankly, in our Illinois region, Illinois part of the region, that goes to the daily efforts that we do right here to give you the most accurate numbers as of 3:30 every day. These numbers are drawn down from multiple sources. We check all the positives, we have their names, we have the negative names. It's all put together in a database. So the number that you get here from St. Clair County is the most accurate number that we believe is out there. So you do have one accurate source of reporting. We're not blowing our own horn. We're just saying that right here, this is where all the numbers are put together at the health department with Sam, who works every day starting early in the morning, drawing down numbers, not only from the St. Clair County Health Department, from the East Side Health District, and they're all merged together and put together in this forum that you have available to you every day at 3:30.
Okay. The next one says, do college student positive COVID test results add to the college town's numbers, or do they add to their hometown number?
So when you get a COVID test, you give an address, and if the student would give the address of the university or the college where they go, then that test would be credited to the address at that university. If, on the other hand, they're giving their address where they live, or if they don't necessarily live on campus, it's going to the zip code where that address was provided. So it really depends on what address is given at the time of the test.
Okay, thank you. Director Simmons, a couple that have come in here. First one more of a statement, but it says, it appears each day you guys are wearing out. I understand that, but please don't let the few discourage what has been done here in St. Clair County. There are many that depend on this daily update.
Well, and we think that, and I can only say that we're just as wore out as probably each of the viewers are. I mean, this has been a long-term project that none of us want to do, but we do appreciate those comments and the thoughts. And yes, there are those days that it does get tiresome. Numbers, I see numbers in my sleep just the same as everybody in the staff here that does. So, but we appreciate those comments. Thank you.
The next person says, the dance routine was great. We need more of you people to share the word. Thank you to anyone that thought this up.
Well, it was a great idea that the young ladies did, providing that routine for us to try to get the word out for the younger population. And we enjoyed it so much, and so have our followers, that we're making that a part of our daily briefing until it's over with. So if somebody's missed it and they want to see it, they can catch it every day on here.
Very good. And one more right now says, I am so proud to be part of Team St. Clair. You have no idea the peace of mind your daily show means to so many of us. Thank you, Mr. Kern and Mr. Simmons.
Well, it's a team effort, as we said, Team St. Clair. It's not one person. We're all in this together from top to bottom, and but we appreciate those kind words. And please, just let's get this behind us and practice the 3 W's, and we'll all get through this as Team St. Clair.
All right. Sam, we'll come back down to some more health department questions. The next person writes, do hospitals have to have separate COVID units, or can they have them on the same floor as medical surgery patients?
Most hospitals have opened a COVID-specific wing in an attempt to keep those patients isolated. So patients that do not have COVID and who are immunocompromised due to whatever reason they're in the hospital, they reduce that risk of COVID spreading significantly.
Okay. The next one says, many schools in our region are requiring teachers to be in a school building every day from 8 a.m. to 3 p.m. If it's unsafe for the students to be in the building, why would it be safe for teachers to be there for a meeting or remote teaching?
So as with everything, it depends on numbers. A teacher in a classroom that is doing Zoom classes, it is far less concerning to us than an entire classroom full of kids. But each school district and their superintendent have had to look at the situation and determine what is best for them and their students.
And when they're not in that classroom by themselves doing the teaching, maybe they're going to lunch or having one of those meetings they talk about, there's still requirements in place to make sure they're wearing the mask,
Absolutely.
social distancing, having all those proper things in place because of the risk that exists.
Exactly. We've had a lot of calls from superintendents and school districts wanting to make sure that they have the best guidelines in place for their staff and their faculty that are on campus and in classrooms, and they've gone above and beyond to keep the environment as safe as possible.
Great, thank you. The next one says, does our Department of Health get the number of positives in schools? If so, why are they not posted similar to the congregate centers? It seems schools are trying to keep their positives quiet.
So IDPH, Illinois Department of Public Health, at this time does not allow for the dissemination of school positives like we do for congregate living and long-term care facilities. However, some of the schools or school districts that have had positives have chosen to make public statements to let their parents know they feel that being open and honest and upfront and letting everyone know before it spreads, kind of behind backdoor channels is the best way to go.
And that's similar to any other business in our community as well.
Exactly.
The health department doesn't publicly announce that a business has an employee that's COVID positive, but we have seen many businesses come out and disclose that.
And, just as with businesses and schools, they feel it's prudent to be upfront, share that information, let the individuals know that have been in that location, all of the steps that are being taken for mitigation, and, so hopefully this doesn't happen again.
Well, Sam, and I think it's worth saying that the school districts, the administrators, are in constant contact with the health department. We've heard the superintendents that's been on our briefings that say, we're in constant contact with them. So if there's something going on within that school district, the health department's going to be aware of it.
Yeah. And we've let everyone know, not only school districts, businesses, daycare facilities, that even if they think it's a silly question or they think they know the answer to the question, don't hesitate to call us. We're happy to be a sounding board or, to bounce ideas off of us just to make sure that they understand the guidance and that they're practicing, the best ways to keep their facility COVID-free.
Very good.
Okay, the next person writes, when is an area such as a city or town no longer able to catch and spread COVID-19? How many times would you need to test that specific area to declare it free of a virus threat?
So due to travel and just activities of daily living, there is no way that we can ever say a specific community is 100% free of the virus if they have had it in the past, or that they will be 100% free of the virus in the future. There's too many contributing factors to be able to say that.
And even with a flu shot, now we all go and get our flu shot, but you can never say that an area is flu-free because some people may not choose to get the vaccine. Sometimes it doesn't work as well as others. So, this is going to be around. We just hope it can be controlled, the spread can be controlled, and then we can get back to living our normal lives. But to be able to say there's an area that's 100% free just isn't.
We'd be lying if we said that, that was a possibility.
And we don't do that.
No, we do not.
Okay. Now the next person says percent positive is higher than before, but why are we shutting down when deaths in hospitals are not up?
So we have seen hospitalization numbers increase, and fortunately our deaths have decreased. We look at those numbers because if we use those numbers as a factor to determine where we need to be, we want to do that beforehand so we don't have the hospitalization numbers go up. We don't want our death numbers to go up. So we're trying to take proactive actions, and by limiting the amount of people that can be in a facility, we're hoping to keep hospitalization numbers down and our death numbers down as well.
Okay. And the next person writes, at church, are members supposed to wear face masks?
Yes, anytime you are out in the public and you cannot maintain 6 feet of distance, it's prudent to wear a mask. Even if you can maintain 6 feet of distance, also prudent to wear a mask if possible.
Okay. The last health department one here today, Sam says, this is a viruses have to run their course. Why are we shutting everything down for something that needs to run its course? We don't ever expect to be at zero.
Again, kind of swings back to the question that I just answered before. We're trying to be proactive about this. We've seen how tough COVID-19 has been in previous months. We don't want to get back to that point. So we're trying to do everything we can to prevent the surge of cases, the surge of deaths that we had in the very beginning of COVID, doing everything we can to hopefully not have that happen to St. Clair County again.
And get us to a time when there is a proven vaccine that is out there, that is readily available, and that everyone has been able to use or have administered to them. So that's what we really are trying to get to that point.
That's our end result.
To
yes.
the vaccination.
And if you think back to the physicians that we've had on here, they've sat here and said, this has been a learning curve for them just as it is for the everyday citizen. They're learning every day about this, and the doctors have been on here has said, until we get that proven vaccine, we're in this for the long haul. And even though if we get that vaccine, people have got to want to take it. And so I just think it's prudent that we keep wearing our mask and doing the washing the hands and all of that.
And even if it does become available this year, it seems that there are going to be then priorities for those who are going to be the ones that are going to get the first doses. Those will likely be people in congregate living facilities and first responders. So even if there is one that becomes available, it will take a while before the average public gets completely vaccinated.
And each of those physicians that's been on here has said one of their big concerns is with the flu season coming up on us, it's going to be a double whammy, and we don't want to overload the hospitals.
Get your flu shots.
Yes,
Yes.
please.
Okay. Director Simmons, while we're there, we'll ask a couple more here that came in for you. First person says, basketball is being played at the Belleville Sportsplex, and I see many of the players not wearing their masks.
I would mention that to them. There's guidance that's been put out there, so if that facility is not going by the guidelines, you as a citizen need to express that to the management and let them address that.
And if people think that because they're athletic that COVID doesn't affect them, just look at the video that we posted of The Rock.
Yeah, Dwayne Johnson.
And Dwayne Johnson and what he and his family went through recently with COVID-19.
Hit as a fiddle and hit all of them. And as he said, and I know him personally, and tough guy, and it knocked him for a loop. So.
Okay. The next person writes, some individuals are not wearing masks. How are they held accountable? Should they be paying a fine?
Well, we've said all along, this is not about writing tickets. It's not about the mass police going to be out there, but it's about responsibility. They're going to be held accountable because if they end up catching the virus, they're going to wish they were taking those extra precautions. And as I've said many times on our briefings here, if you're not a part of the solution, you're a big part of the problem. So it's about compliance, and that's all it's about.
And Herb's a part of the solution. He's not going to say this, but this morning there was an event where homeless individuals, people without addresses, were getting socks and other items, and Herb brought masks so that as part of that, those individuals were able to get masks also, so they can comply, because perhaps they didn't. People can wear them, but they've got to have them to wear them.
And a few of them were extremely excited about it. Now, they felt comfortable because they didn't have them, so now they do.
Okay. Chairman Kern, another question about zip codes. It says, the positive case numbers keep going up in 62254. Is the increase due to students that reside at the university?
So, as we said earlier, the address where the student gives, that's the zip code that that will be affected by a positive or by a positive number. And so, the answer then is yes, if that's where the student is giving their address, as long as they're saying it is at McHenry University and that's where that zip code is. Then that's what would happen. And I think anecdotally, we have heard that there are cases there, so it very well could be that this is the case.
Okay. As we're talking about schools, we're joined each Sunday by the Regional Superintendent of the School, Susan Sarfati, because there always seems to be a question that come in about schools. And we got a question today, and it's pretty upfront. It says, what is the criteria to reopen our schools?
Well, first of all, let me say that each school district makes their own decisions about when to open using the guidance that we're getting from the health department. The Illinois Department of Public Health, IDPH, has on their website a section just for schools by county in the state. And there are 4 different metrics that we're looking at when we determine whether it's safest to open schools. One is test positivity. The other is new cases per 100,000 people, then new cases, period, and then finally the 4th one is youth new cases. And they give each one of those different metrics a number, a name, which is substantial or minimal, and they give them a color, red, there's orange, and then there's blue. 2 of those numbers for the past week were blue. That was the new cases and the youth new cases. But 2 of them were red, substantial, meaning there's concern. And those were the new positivity and the new cases per 100,000.
Okay.
So we're looking for all orange or blue to have a really good, solid, let's go back to school.
But with that being said, we do have some school districts in our county that have elected for in-person learning. And all school districts do have that option if they can meet the requirements set down by the State Board of Education and the Department of Public Health.
And that's because every school and every school building is different. The number of students that are in that building is different, and the configuration within that school, as well as the ages of the students in the school. We also have some guidance from the State Board about who to bring back first. The students that have IEPs or special needs, they're requesting that we bring those students back, and then English language learners, and then other students that are experiencing difficulty, that are what we call at-risk students, and then slowly bringing back the rest of the population, younger to older.
Okay. Thank you very much.
Very good, thank you. Always appreciate the school questions and hope we can answer them. There's quite a few questions come in, but we can't get to them today, but we will sort through them and try to get you the answers for them. We want to thank everybody for tuning in on this Sunday afternoon, and again, thank you to all of Team St. Clair members. We hope everybody is enjoying their Labor Day weekend to the best that you can. We hope you're practicing the 3 W's, staying safe, staying within your own little group of family members, hopefully carefully and wearing your mask, washing your hands, and maintaining that physical and social distancing because we got to do that. We said all along, holidays, we worry about the spike, and in the past we've seen that, and we hope you can all prove us wrong on this one. And right now we want to show you that video again from the Expressions Academy of Dance of Belleville. I think that sends a word for our younger population to get out there and practice those 3 W's. We will be back here tomorrow, Labor Day, to bring you the next briefing. Have a good evening.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed, don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish, don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Scrubs, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and